Well, Deb Stana, we spoke with a mental health expert here in Baltimore. She stressed the importance of limiting exposure to those violent images.
It brings our spirit down. It affects our mental health. And when it affects our mental health, then it affects every aspect of our life.
Like so many others, Baltimore mental health expert Jan Desper-Peters has been monitoring the chilling details of what happened to television reporter Allison Parker and photojournalist Adam Ward in Virginia. But she warns that consistently viewing those graphic images that are so constant and accessible could have a serious impact on mental well-being.
Make a conscious effort to monitor the amount of time that you're watching it. So I'm not saying don't be in tune to what's happening in your world, but to overly saturate yourself, overly saturate your mind, overly saturate all of your, your eyes, ears, and all your sensory perception to the violence that's going on in our world, especially what's happening today, is going to have a negative effect on us.
The shooter posted a video of the massacre to his social media accounts that has been deleted but is still circulating on the internet. He was fired from the station where the victims worked 2 years ago. The general manager described him as unhappy and angry with a reputation of being difficult to work with. Desper-Peters' organization, the Black Mental Health Alliance, serves nearly 2,000 people in Baltimore each year. Without referring to the Virginia incident specifically, she stressed the importance of mental health intervention in the workplace.
So I think that there are some things that we can prepare ourselves for, especially in a professional environment where we know that people can be disgruntled because they're going to be let go. And then how can we afford them the support systems that they need so that it doesn't get to these extreme levels?
And she says open and frank discussion about growing fears and concerns about violence can be essential for both children and adults.
Therapy is not always long-term. It can be short-term, and I think that we need to stop talking about it in terms of something that's bad or something that reflects upon us as if we have some kind of weakness. But it's actually a sign of strength to say, I need help.
And so we have information about local mental health resources on our website, WBALTV.com. Reporting live in the newsroom, Kai Reed, WBAL TV 11 News.